after birth.
If you were aware that the mother was going to have a baby around 24 to 26 weeks, what problems would you contemplate you would be concerned about initially?
A baby of 26 weeks gestation faces a myriad of serious issues, and each one of them will come into play in a different time after birth when various organ systems are being recruited and called to take focus in the life of a newborn. Initially, obviously, because breathing and oxygenation is the most critical issue, immaturity of the lung is going to be the main issue in these babies. So they may develop a condition that we call RDS, or respiratory distress syndrome, because of the lack of surfactant.
First of all, you use the word surfactant. What is surfactant?
Surfactant is a chemical within the lungs that reduces the surface tension of the lungs and enables the lungs to inflate very, very easily without exerting much effort. Because our internal body is really fluid and we're living in an air environment, at the junction of the air and the internal fluid milieu, we form a surface membrane which can cause tension and causes collapse of the lung. We create, or we form, a chemical that prevents us from having the lung collapse, but premature babies, because of the immaturity of the lung, are not capable of producing this material, and we may have to introduce this material artificially after birth, especially if they have extreme prematurity and what we call RDS.
So in other words, we can't artificially give surfactant.
Yeah, we do have artificial surfactant. There are various types of surfactants that are available today commercially. Some of them are artificial, some of them are recombinant from animal extractions, and we introduce them into the baby's lungs and help them fight this condition. Once they get over the RDS, or they get stable enough with that condition, there are other issues that may come upon these babies in the next few days. Obviously, every time an organ system is being recruited, because of the extreme immaturity, these organs are not fully developed and they may not be able to function wholly or as well as that of a mature baby. So we may face some problems with them. In particular, cardiovascular systems such as the heart. These babies may have a condition called patent ductus arteriosus, where certain blood vessels that are open in utero, which allow the baby's circulation to function in a particular fashion, does not reverse to the full adult type of circulation, and may impose stress on baby's lungs and heart, and that may have to be addressed. That may happen usually after about several days to a week. When we are facing a situation where a baby may need to be fed, or we may have to address the nutritional needs of the baby, after several days, a week or two, we may have issues with the gastrointestinal problem because the gut is not mature enough and cannot handle the load of the feeding of the baby. The immature vasculature of the baby in the brain may be associated with various injuries to the brain, such as bleeds and infarcts, and may cause various other problems. So every phase of the infant's development may be associated with various problems and complications.